You're listening to the Tooth Sleuth Podcast, all about the business of dentistry, hosted by yours truly, Greg Esenmacher, a fixed full arch dental expert and founder of G&A Consult, speaking with industry leaders on the dental landscape from their perspective. At G&A, we specialize in transforming full arch dental practices, teaching, coaching, and training teams to deliver an exceptional patient experience, from that first call to delivering final smiles. Whether you're a practice owner, a DSO executive, or a regional leader looking to expand your full arch program, boost same-store sales, or unlock the true profitability of full arch cases, we've got you covered. Ready to see how full arch can elevate your practice? Visit the show page or book a discovery call today. Let's turn your potential into results. Welcome back, everyone. Tooth Sleuth Podcast, your host, Greg Esenmacher. I hope you know who I am. If not, like, share. What else do you do? Subscribe? I don't know. Something. Follow me. Do something. Listen, my guest today is Kirk Teachout. I have just met him fairly recently, but it's definitely somebody who I'm going to know for a long time. He's like me. He likes to play. He likes to have some fun. If you don't follow him on socials, you need to start following him on socials. He's got some really cool content, but that's not why he's here today. He's here because he's a powerhouse in dental. Kirk, why don't you introduce yourself to my listening audience?
Wow, that was an intro. Yeah, so my name is Kirk Teachout. I am a self-proclaimed content creator trying to help dentists just like my wife. So we bought a practice 6 years ago, only working 3 days a week. But I'm not from the dental world. I'm actually from the music industry. So I try to make sure that I make it fun and entertaining like the entertainment industry and try to think outside the box because, if you cut the end off the ham and put it in, we got to figure out why we do it, not just because we do it. So that's kind of me in a nutshell.
Yeah, and I got a chance to meet you over at the Dental Festival, and what an amazing experience that was to hear you speak from the stage and share your passion and your experience about helping your practice, helping your wife and that practice grow, and exactly how you do it. And one of the things that stood out to me, and I really want to dive in on this topic first and foremost, at G&A Consult, we work on conversion, case acceptance, and really foundational in that, and we'll talk a lot about that. But one of the things you said that landed really strongly with me, it's okay to tell a patient no. Right? When you set a firm boundary and say, you know what, we're going to call to confirm your appointment. And if you don't answer, you lose that spot. Talk to my listening audience a little bit about that, because I'm sure there's fear, of the listening audience then and now that you don't hold a spot for somebody if they don't confirm that. So talk to me a little bit about that. That was amazing.
Sure. So in 2023, we set out for the whole year. Our main focus was our ideal patient. And in that year, we either formally or quietly dismissed over 200 patients that year because they didn't meet the standard of the office, the standard of care that we were going to present and that we really hope to obtain. So that way we can get 100% healthy. So, we just kind of built in these systems to where okay, well, if you refuse x-rays, that's fine, but I don't believe this is the right office for you. Or we have, hard conversations with them in the chair to try to get them to that standard. But, and most of the time they get to that standard. But sometimes, unfortunately, we have to, hit them on the back of the hand and be like, hey, we're going above and beyond to make sure that your experience here is amazing and respect your time. But we require a mutual respect and trust. So that requires you to let us know if you need to be there. Things happen, totally fine. You wake up throwing up. I don't want you to come in. But if you don't confirm your appointment, then I will double book you and or reschedule. So we will call people 24 hours before that are not confirmed still after all of our engagement and all the things have gone out. And just say simply this: hey, Miss Jane, it looks like you unfortunately haven't confirmed your appointment for tomorrow. But if you just let us know before noon today, we'd be happy to help you. If not, we're going to have to reschedule this appointment. And we will hopefully look for their, confirmation before noon. But if not, totally fine. We rebook that appointment. 9 times out of 10, what's going to happen? She's not going to show up anyway. But just in case she does, then you can simply say, hey, Miss Jane, we've been trying to get a hold of you to confirm this appointment. Unfortunately, we're going to need to reschedule this because we've already booked someone else. However, does a Tuesday or Wednesday work better for you at 1 or 10 o'clock? And we just kind of, and I got that from you, right? So making sure that I have open, a couple of different spots versus just say what day works best for you. But still, yeah, if you have that standard and you hold patients to that standard, they end up respecting your time. And most of the time, they don't care anyway. They're either not going to show up, or if they do, they're like, I am so sorry. I will make sure next time that I do confirm it. So that way I am here.
I mean, it's sounds like common courtesy, right? But what I'm hearing from you as well is really being able to have healthy boundaries, which is something that we all need to have in our personal life, but also in our business life. It's okay to set a standard and then follow through with it, right? Because it's just like with kids, right? I think you have a handful of them, right? You can't play man-to-man defense anymore. You've got to play zone between you and your wife. It's important to be able to then follow through, right? Say what you mean and mean what you say, which is critically important, and I love that. But I do want to go back because in the beginning you were sharing about, for example, like X-rays and refusing X-rays and treatment and things of that nature, which is really for the overall health and care of the patient, which is what it sounds like you really teach and preach. A lot of that has to do with education, right? And
Yeah.
what verbiage we use at GNA Consult is the why behind the what. The what is the X-ray, right? The what is the treatment, right? The what in our language is the prosthesis. The why is why now? Why are you going to move forward now with this implant or this fixed full arch? Why is it, if you've been in this condition for so long, that you're going to move forward? And the same of what you're describing is, well, this is what needs to happen, an X-ray, and this is why it needs to happen. And it's okay if you choose that that's not what you want to do, but that just means that you're not a match for what we do with our care for our patient experience. And I love that. So talk to me a little bit about what does that education process for your team members as well as for the patient experience, because it needs to, I would imagine, has to be 360, everybody on the same page and that belief philosophy. Because if you're going to dismiss 200 patients to really align, I would have to think that that is something that you worked on quite a bit to get everybody on the same page.
Yeah, so we use dental intelligence for their analytics, and I think the most overlooked and honestly the most hidden analytic that people overlook is the treatment dollar acceptance percentage. So most people will look at treatment acceptance, they'll look at case acceptance, which those are two different things, right? So if you present 10 fillings and they do one and schedule it, then that's a 100% case acceptance, but it's a 10% treatment acceptance. So I look at the treatment dollar acceptance percentage because that really tells you how healthy you're getting your patients. So for instance, in the last 3 weeks, which now we're presenting more larger cases, so it's a little lower right now, it's about 56%. But when we were just pushing bread and butter dentistry and trying to get people 100% healthy, my wife's treatment dollar acceptance percentage was 86%. And just for numbers for everybody listening, the average across the US is 30%, which is the reason why you have $500,000 to $1.5 million, depending on your size, of unscheduled treatment just sitting in your practice, right? So if you can now get people closer to that finish line of 100% healthy, then you're not only doing your practice a service, you're also doing the patient the ultimate service of getting them 100% healthy. I can't tell you how many times I use this analogy of gangrene on your leg, right? If you have gangrene on your leg, somebody is not going to say, well, what does my insurance cover? They're going to say, no, we got to get it out. And the doctor is sure not going to say, well, I can only take 20% of this off because that's what your insurance is going to allow. No, we're going to figure out a way to get it to where we need it to be done, right? And so, to your point, the way that we really train this is by allowing the team to do the heavy lifting. My wife does not do the heavy lifting. She will come alongside of them, make sure that they have done the education piece of what they see. They're providers. They know what they see. They're not diagnosing, but they know what is there, and they take pictures and throw it up on the big screen. So that way, when my wife comes in, they've been, however long it's taken her to go to go get her for the exam, they've been staring at that tooth that's cracked all the way across, or that plaque that is just all over, right? And they're just looking at it like, I don't want that in my mouth. And our team is like, hey, there's a crack here. Do you know what a crown is? Okay, do you know what that process is? They go through that process. I'm like, well, that may be something Dr. Lauren, suggests. So I just wanted to give you the information. Or if they have a gap between a couple of teeth, right? I use non-dental jargon, by the way. I'm not going to say actual specifics, but if they have a space there, right? Okay, well, this is the problem with a space, especially if it's on the lower posterior. It's like, okay, well, the tooth above it is going to start falling out, right? You're going to have some problems there. So you really need to fill in that gap. So, here are your options. You can have the most expensive is obviously an implant. Do you know what that is? Yeah. Okay, cool. Well, you could also have the middle of the road, which is a bridge, which is okay, but it's not the best. And then you have a partial that nobody likes, but it is the cheapest, most affordable option. Which one is more suitable for what your budget is? And so they go through that before my wife even comes in. Then my wife comes in after they've had a little powwow before coming in, like, hey, look, I agree. Like number 15, it has this big crack. You need a crown. Did Lee go over that with you? Yeah. Okay, great. Did she explain it? Do you have any questions about that? No, she did a great job. Yeah, she always does, doesn't she? Lee does a great job. And
Give
you're
you
always
improvement.
talking up providers. Yeah, you're always talking up providers, right? Like, she does a great job. Yeah. And you're like, I agree. This is something that needs to be done. Is there anything besides finances that would prevent you from moving forward with this treatment? So now you
Narrow
have,
down the scope of the no. Yep.
yes, every objection is gone besides the financial one. So that way, when they take them up to the front, the only objection that the front has to figure out is the financial one. And then my front also has kind of parameters of what they can do. So we have the ability to be able to do in-house payment plans if we want to. You could do, Cherry, Sunbid, Care Credit. You could do all that too. But my front has the ability to, if they scoff at one down payment or whatever, it's like, hey, they can go up to 4 months worth of payment plans without my authorization. And that alone has changed the game of what we can get scheduled, as long as they're not a new patient, because we have no, trust built right at that point. But at that point, now that you've gone through this process of the team constantly handing off, building trust, to where when my wife comes in, they just lob it up for her. She knocks it out of the park, and she's like, okay, cool. I'll see you soon for that crown, and walks out. And that's an important piece, because she's not saying, okay, well, Lee's going to take you up to the front. She'll do all that. But the last thing that they hear is urgency. Okay,
Mhm.
I will see you soon for that crown. And then she leaves. And in their mind, in the chair, they're like, oh, I need to come in soon. And then it's continually reinforced throughout the next couple of touch points between the hygienist and also to the front before they leave. So there's like this really smooth circle. I know you can't see it for those who are just listening, but there's this really smooth circle
Huh.
that goes from front to back and back to
Imagine
front.
find a circle.
Right. That goes from front to back and back to front to where it's frictionless. Constantly talking up providers, and that patient experience right there, that's just on the hygiene piece, right? Then you get to the emergency side, and you can do all sorts of stuff on that side. But I like to start with that because that's a massive way to help your patient experience along. That doesn't take a med spa to really convert people. It just takes who does the heavy lifting, what verbiage do you use, and where does the education really land?
Yeah, and the primary responsibility that you're talking about, right, it lies with all of the team, right, and supporting the practitioner because they're the most expensive thing in any practice, and the handoff, hand up, which is critically important. And then the last piece that you really were hammering on there, which is the empowerment of your team members. Right. As leaders, we don't cede authority. Right. This comes from Phil Jackson in his book 11 Rings. Right. The 11 Rings referencing his NBA championships, who was trying to handle many personalities from Kobe and Shaq to Michael Jordan and you name it, all the way to the role players. that you empower them, right, with what they're skilled at once you've trained them and continually train them, but you don't cede your overall authority. And once you have the ability and the vision to do that as a leader, you get the most out of your entire team. It's not individual contributors, it's team players, and the success of the team becomes greater. And that it's really important points to leverage there, and being able to share that with other groups and teams and doctors, and it's just so valuable. And that's something that you're doing as well. I think that you have a retreat coming up that ended up selling out, if I'm not
Yep.
mistaken, right? And you then, I know you're talking about another one. Talk to me. Tell me a little bit more about what that is. I caught little snippets of it on social, but
Yeah.
I saw you hiking and talking about it, so I know it's more than just sit in a classroom, with the shades pulled and PowerPoint presentations. I'm sure it's going to be more dynamic than that. So share a little bit more about what that looks like, because I'm sure people want to hear about that.
For sure. So the Zion Mastermind Retreat currently anyway, is from 8 to 2. So we come in on a Wednesday. Everybody gets in on a Wednesday. We start early Thursday morning, and Thursday, Friday, and Saturday is all it is. And then we leave on a Sunday. But Thursday morning, we start from 8 to 2, and we go through all of the main systems that me and my wife have in our practice. So we go through standards, we go through AI, we go through all sorts of stuff. And then at 2 o'clock, we head out to Zion National Park and we do a big hike. So not only are you getting the information, but you're locking it in with that kind of euphoric, I've conquered something of climbing a mountain afterward. So it's going to really instill it a lot better to me, from what I understand about psychology. And then we're going to do the same thing on Friday from 8 to 2, workshop, finishing up there, and then hiking another spot Friday night with another dinner at that night. But Saturday is no workshop in particular. We are just going out to Zion and hiking the Narrows, which is a very long hike through the Virgin River, and just hanging out. We're getting out of our comfort zone by hiking through a river and through this 1,000-foot slot canyon that's on either side of you, and just talking about our practices. And I started this retreat because I would always go to CE with my wife. So Scottsdale being, we've been there a million times. I love that area. I always spend way too much money at that mall there, though. So I try not to go very often.
Fashion Square.
But
It's in my backyard.
yeah, so it's that or the pink is it the pink palette? I don't, it has a Tesla and a Rivian place in it and all sorts of stuff. But anyway, so we go to CE, right?
Scottsdale.
And I love,
For those of you who are just in the listening audience and don't know the
yes, yes. So great,
Fairmont
great
Corporation,
mall.
it's called. Yep.
Yeah, it's a great mall. So so I would go to CE with her, and it was, I would just be working in the hotel during the day, but the magic would really happen at night when everybody would go to dinner and everybody was already on the same wavelength, thinking the same way and learning new things. But when they got to dinner, they were talking about each other's practices, and this magical thing was happening. And I was just sitting back and just watching these doctors and practice owners really give each other nuggets and pull together their struggles and figure out ways to overcome them. And I was like, okay, I want to replicate that. And so now, doctors don't do anything without CE. So I had to have that piece. But we're going to learn together. And there's practices that are $10 million practices all the way from newly acquired practices. So we're all going to be kind of mentoring each other, coming together, and just hiking, doing outdoor stuff, which is a passion of mine and my wife's. Anytime we would go to CE, we would find a place to hike, and that's kind of what we like to do anyway.
And the Valley of the Sun's a great spot to do that. So now I know why you've come here a million times to do it. And it's one of the main reasons that keeps me here and has had me here for 26 years now, is all the great hiking. Not only here, but within a couple of hours you can get to some just breathtaking hiking. And yes, it's okay. I survived during the summer. I haven't dehydrated yet. It's all good. Well, Kirk, this is the part of the program all of my guests play a little something called What the Sleuth is Going On. It's 3 rapid fire questions. First thing that
Okay.
comes to mind. Are you ready to play?
I'm ready.
Okay. Question number 1. What's the worst bad breath you've ever encountered?
Oh man. So I walked by a hygiene room where I have never seen like such bad perio, like and buildup. Like his buildup was essentially holding his teeth in. And I was just like, I can't. Like the hygienists were like, "Yes, give me a hammer and a chisel and I'll go." Like they were they were ready. But I was just like, I can we had to like spray that room afterward. It was so bad. I did not feel comfortable bringing another patient back. Um, oh man, that was bad. Couldn't do it.
The perio breath it seems to be the theme of stories of anyone that's clinical in dental or anyone in practices. It's one of the there's a few other good stories, but for sure, yeah. Question number 2. If you could change one thing about your smile, what would it be?
So right here, I got my laterals and they sit back. And the only way that I can really pull those forward is through traditional braces, and I'm not willing to pull like
You're not
I'm
gonna
not
put on
willing
the
to do
metal
it.
grill?
No,
Not
I'm
willing
not.
to do it?
I've had metal brackets 3 times, and I'm just not gonna do it.
For those of you listening just on the audio portion on whatever podcast platform you're on, hop over to the YouTube channel at about the 21-minute mark. You're seeing we're done. That's why your head does just because he's giving a visual. That and you can do the circle, right? I mean, I think everybody knows what a circle looks like, but the visual I'm like pointing to is laterals there. That's next level. Thanks for doing that. Question number 3, last and final. If you could go back and be the inventor of any dental product, and no, you can't choose your own, which one would you choose and why?
Hmm, dental product. Man, that's a good one. I don't know because I feel like see, this is what's gonna drive innovation from your podcast because people are just gonna be like, "Oh, yeah, this would be really cool to do." I to me so I have a VA in my coaching program. That's the only thing. It's just me and a VA. That's it. And I do the majority of everything. They just kind of work behind the scenes. So we it's a requirement for us to use ChatGPT 100% because not to like recreate stuff, but to get 3 times more the output, right? And help as a sounding board to do things. I would love to have a product that essentially is on an iPad or something maybe that as you're putting things into the chart, or you're, dictating it, whatever you want to call it, it automatically pulls up the treatment plan and how you should, like what verbiage you should use to present that to the patient based off of maybe some information you get from the patient, not necessarily just a standard whatever. Not that I'm having patients do disc profiles, but everybody's different, right? Um, and how they do it, like, whether it's visual or auditory. If there's a way to do that, I think that would be really cool.
Nice. Yes, this is how I'm vetting new ideas for my. No, just kidding.
Trademark pending. Trademark pending.
Right. He verbaled it, so it's safe. No, I appreciate everything that you shared, right? And I want to respect the time of my listening audience. And, if somebody's on scuba gear or, running on a treadmill, it can only last 30 minutes to keep it within that time frame. So in the last few minutes, Kirk, anything that you haven't shared with my listening audience or that you're dying to get off your chest here on the Tooth Sleuth podcast before we run?
Yeah, I would say that, and this is how I start most of my talks, is nothing that we talked about here matters. It really doesn't. If you can't set a standard and hold people accountable to it, whether it be your team or yourself, because a lot of people can hold themselves accountable to a standard. Some people can hold their teams to a standard, but most people can't hold their patients to the same standard. But if you can hold all 3 together, you'll have an incredible practice and an incredible life.
No, I love it. Definitely words to live by and some wisdom to close out the show here. Thank you so much, Kirk Teachout, who's been my guest here on the Tooth Sleuth podcast. I appreciate your time and all the pearls that you've dropped here on the show today. Thanks so much. If you need help with converting lead calls into consultations, closing consults into more full arch cases, or creating a more strategic marketing message and branding for your practice or group, follow me for more tips or reach out to G&A Consult for a discovery call today.